Someone is asking, how does NHI work for government employees?
We are in the process of negotiating some of these initiatives. We understand that we have unions, we have different entities in the government, not just in the government, but in the private sector. So we have to work with those entities. But many of these entities already have an insurance policy. So it's actually easier for us to work directly with the insurance company that they are insured through and do an arrangement with the insurance company. So when care is required, we will work with the insurance so that they don't have to pay for services first and get reimbursed. I think the greatest accomplishment we could provide for government workers and others is when they go to the doctor that they don't have to put their hands in their pocket to pay for it. If we could work through these insurance companies, and the NHI has a contract with these insurance companies, and it's one entity dealing with those entities, where NHI is getting reimbursed, and we are now, they provide us a guaranteed payment also. So we are offering two things at the same time by having an NHI. We are guaranteeing payments to the providers, and we are guaranteeing workers that they now are not paying the dollars to the doctor or paying it to the system, but through the NHI, those dollars are paid. So, of course, you're going to have your copay, your deductible, and all those things, but I'll tell you the other thing that will happen in NHI. Because now we have that government tier of benefits that's available to all citizens, now the private insurance will build a policy and their benefits on top of that. So that'll result in a lowered premiums for the people that actually buy health insurance. And therefore, more people that want health insurance will be able to afford it. So we believe the system we've created will ultimately get more people involved in insuring their workers. And I'll tell you one more thing. Most countries that develop national health insurance have very strict mandates that compel consumers to do a lot of things. What makes us different from many other countries from a legislative standpoint is that we have put very few mandates, if any, on the public. Most of the mandates that we put in place are on the non-public, and even those are very limited. We use the power of consolidation and incentive to drive people to participate. And that model is something that's lacking in most of our Caribbean programs, is that I said earlier about if you let spillage or seepage of dollars out of the system, escape from the system, and you don't consolidate that dollars, you have to have mandates in your legislation. But because of the fact that we have organized this system such that all parties come to the table and contribute in the system, there is less requirement on the laws to create mandates. I know how Grenadians hate mandates in legislation. So and that's one of the ways that when we sat down to work with the people who help us write the legislation, and that's still in review, by the way, is that we made sure that we would reduce, if any, mandates. Mandates are things that says you have to do that, else there's a penalty. And that's an important part for Grenadians to know, is that despite the challenges that this poses in many nations to consolidate, we've been successful when we wrote the legislation to avoid these types of mandates.